23/7/2025. Chapter 3: Quality Control of Crude Drugs. Adulteration of crude drugs. Adulteration is a process of substitution of original crude drugs, partially or wholly, with other similar, other-looking substances, or with anything which have inferior quality than the original one. Example: black pepper plus dried papaya seed, Crocus sativus, Carthamus tinctorius. Adulterant: it is that material which is added in anything to make it adulterated. Types of adulteration: 1. Unintentional adulteration, indeliberate. 2. Intentional adulteration, deliberate. Unintentional adulteration, indeliberate. It occurs due to morphology, lack of knowledge, confusion of names, careless collection from the source. 2. Intentional adulteration, deliberate. It occurs due to scarcity of the drugs, high price in market, to gain profit. The intentional type of adulteration. 1. Adult using artificially manufacturing substances. The artificially manufactured material was used in making the substance adulterant. The material are prepared in a way that its appearance resemble with the original drug. Example: compressed chicory is used in place of coffee. The substitution using inferior commercial varieties. The original drug is substituted by inferior quality drug which may similar in morphological character, chemical constituent, or therapeutic activity. Example: hog gum is used to adulterate the tragacanth gum. 2. Substitution using exhausted drug. The active medicament of the drug are extracted out and then used again. This technique is used for those drugs which contain volatile oil such as clove and fennel. Example: after extraction, saffron and rose petals are recolored by dyes and used. 3. Substitution of superficially similar inferior substances. EXP, peach kernels, and apricot kernels are adulterated with almond. Evaluation of crude drugs. It may be defined as the determination of identity, quality, and purity of drug. Identity: identification of biological source of drug. Quality: quality of active constituent present. Purity: presence of foreign particles in crude drug. Following methods are used to evaluate the drugs. 1. Organoleptic evaluation / morphological, PCP&M, microscopic, biological, and 4. Chemical, 5. Physical organoleptic evaluation, morphological. It is also known as anatomical evaluation. This method allows the detailed examination of crude drug and be used to identify organized drugs by their histological characters. This is useful for organized drug which were prepared in powdered form or cut into thin slices and observed under the microscope. Microscopic evaluation are as follows. 1. Palisade ratio. It is an average number of palisade cell beneath each epidermal cell. It can be determined with powdered drug. 2. Stomatal index. It is the percentage proportion of the number of stomata to the number of epidermal cells. It varies according to the age of leaf. Formula of stomatal index: SST equals stomatal index times 100. E plus S equal number of stomata per unit area. E number of epidermal cell, same unit area. Stomata: it is a minute opening in the leaf which helps in gaseous exchange of the plant. Physical evaluation. Content are some common parameter used in physical evolution. Chemical evolution: the isolation, purification, and identification of active chemical constituents from crude drug are chemical method of evolution. Quantitative chemical tests include identification for various phytochemical like alkaloids, glycosides, tannins, etc. Qualitative chemical test such as acid value, ester value, acetyl value, volatile oil. are also useful in evolution of a drug by mean of chemical treatment. Chemical assay includes assays for alkaloids, resins, volatile oil, glycosides, vitamins, or other constituents. Biological evolution. Potency of any crude drug or its preparation by mean of its effect on living organisms like bacteria, fungi, animal, or animal tissue is known as biological evolution. Bioassay. Bioassay can be done by 3 types. I. Toxic, symptomatic. 3. Tissue method. In toxic and symptomatic methods, animals are used, whereas in tissue method, the effect of drug.